afternoon. I'm Elisabeth Long, the Sheridan Dean of University Libraries, Archives, and Museums at the Johns Hopkins University, and I'm delighted to welcome you to the opening of Love Data Week 2024 at Johns Hopkins. Love Data Week is an international event where institutions, organizations, scholars, students, and other data lovers come together to celebrate their data. We are fortunate to have speakers from a variety of disciplines within Johns Hopkins and beyond come together to share their diverse perspectives and celebrate data with us. Here at Hopkins, Data Week has been organized by the Johns Hopkins Libraries that consist of the Sheridan Libraries, the Welch Medical Library, the Arthur Friedheim Library, the Applied Physics Lab Library, and SAIS Europe Library. This is the fourth year of Hopkins Libraries presenting Love Data Week. The celebration has grown from a few workshops to what we have this year of 5 full days of keynote, panel discussions, and workshops for all disciplines and all levels, from beginner to advanced, and with speakers from within Hopkins and beyond. There's something for everyone here, and we have grown from 30 people registered in the first year to close to 600 people registered this year. So I'd like to thank all the speakers, panelists, moderators, and workshop instructors who are participating to offer these great programs this year. I want to talk a little about the staff at the Hopkins Library. We are key partners in knowledge creation. We play an active role at all stages in the research planning process, providing information expertise to develop data management plans, to identify appropriate data description, and create preservation strategies. Our staff have the advanced data management skills required for data-intensive research, helping Hopkins faculty, researchers, and students with their consulting services related to data management, access, visualization, curation, and sharing. We provide infrastructure for data preservation. We provide training for researchers on best practices for handling data. I'd also like to thank our sponsors that include the Institute for Data Intensive Engineering and Science, the Stavros Niarchos Foundation, the Agora Institute, the Alexander Grass Humanities Institute, and the Krieger School of Arts and Sciences. Before I begin, I would like to remind everyone to please enter all the questions you have in our Q&A box. You can use the chat to communicate with the host if you're experiencing technical issues within the webinar, and that will be monitored throughout the webinar. It's now my great pleasure to introduce our keynote speaker for Love Data Week, Dr. Anna Navas-Acien. Dr. Navas-Acien is an MD and PhD, a professor of environmental health sciences at Columbia University, Mailman School of Public Health. Her research investigates the health effects of environmental exposure, molecular pathways, and gene-environment interactions, and effective interventions for reducing involuntary exposure and their health effects. She trained in medicine at the University of Granada, Spain, and completed her residency training in preventive medicine and public health at the Hospital La Paz, Madrid, and her PhD in epidemiology at Johns Hopkins University, Baltimore, Maryland. She directs the Columbia University Northern Plains Superfund Research Program, a center that integrates science, technology, and traditional knowledge to protect the Northern Plains water resources and indigenous communities from hazardous metal exposure. Among other advisory committees and roles, she serves as a member of the National Cancer Advisory Board. Dr. Navas-Acien's topic today is Environmental Health and Justice, the Power of Community and Interdisciplinary Science. Please join me in welcoming Dr. Navas-Acien.
Wonderful. Thank you, Dean Long, for the introduction and the opportunity to present here today. I hope you can hear me well and that everything is going well. It's an incredible honor for me to be part of this Love Data Week. I have a tremendous love and respect for data and how important data is for science and society. And also, as I train at Johns Hopkins University myself in epidemiology, And I spent many hours and in the libraries, in the Hopkins libraries, and I am very, very grateful for this honor. So I am going to share my slides. Excellent. And so this is the topic: environment, health, and justice. And I would like to highlight, first of all, the Columbia University Northern Plains Superfund Research Program. And Dean Long provided you with this mission for our center. And I think it's a good representation of how science nowadays really needs to take place, combining the multidisciplinarity of sciences, but respecting, and technology, which is so important for science and for society, but respecting at the same time the knowledge, the traditional knowledge, and the forms of knowledge that are really important and that sometimes have been not received the attention that they deserved. In this logo for our center, which was created by indigenous artist Tammy Granados, you can see the Northern Plains states, the Missouri River watershed, and the Lakota traditional healing wheel that represents the 4 directions as well as the 4 different stages in life. And I want to start this presentation with some of the indigenous principles that motivate our work and partnership. The importance of collective leadership. This work is not a single PI, a single person who is really leading the work, but it's a collective effort. Traditional knowledge is critical. Respect for water, in our case, because our center focuses on water, but also the environment, natural resources, and the sense that humans, we are part of this bigger environment as one more piece, not as at the center of it or the unique element of it. The 7 generation principles, which indicate that decisions, when we make decisions, we need to think backward for where we come from as well as forward, and the impact that our decisions will have in 7 generations down the road. And relationality, how connections are circular and have multiple feedbacks, like physiological processes in the human body, rather than just linear processes. We also have, we need to, when you do this type of work, you need to accept the research goals that tribes have developed, and that in many ways are really at the forefront of cutting edge and science and ways of handling data. The concept of sovereignty and data ownership, the idea that communities, in this case tribal communities, have an important role in the review of the science, independently of the institutional review boards, with their own research review boards that are going to review protocols, but beyond the protocols, they are also going to review the end product of the scientific work, which is the publications. And also the engagement in communications of the findings, and the fact that the communities are really interested in being at the part of communication and dissemination and the impact that the science has. So this is the center with the 5 projects, combining biomedical sciences, engineering, combining different parts of at Columbia, our local research partners in the Northern Plains, Missouri Breaks, which is a local research organization, different schools at Columbia University, the Stronghold Study, tribal organizations, governmental entities. But when you think of all the work that is being done by a center like this one, a lot of data is being handled. A lot of data is needed to do the work. So the key questions are we need to answer and think about them. One is data ownership. And when I was a student myself, I was very naive. I thought I own the data that I generate. Then I learned, when I became a junior faculty, I realized that probably not. Maybe my institution owned the data, and this is why we need to sign material data transfer agreements and lots of processes, approvals to handle data transfers. maybe the government owns the data because they are funding most of the research, or the funding agencies have rights to the data that they funded to be generated. However, and for that reason, who owns the data is very important, because they are the ones setting the rules for data sharing and the terms for data sharing. And the question is also then, who is going to profit from research? When working with indigenous communities, I came to realize that data ownership is something very serious, and that the communities and the individuals who in the first place have allowed for that data to be collected have data sovereignty and data ownership. And I want to bring here the message, which is very powerful, from 3 indigenous scientists. They published this article in Nature a couple of years ago, which I think is a really powerful message, that data are not a gift. At best, they are on loan, and hence revocable if misused. Data are a responsibility, not an entitlement. And I think as scientists, we need to recognize that we don't really own the data. The data are a gift given to us. The communities that we work with are the real owners of the data. And that really changes the dynamics in how you do this work. And for me, this has been a really important lesson that I felt was really powerful to bring in a Love Data Week event, such as we are celebrating and you are starting today. So also knowing who you are, where are you from, where do you come from, and what's your background is really important for indigenous communities, thinking backwards and thinking forward. So I want to share with you a little bit who I am. I was born in the southeast of Spain, in a part called El Ejido, Almeria. This is a very desertic area, and water resources were scarce. And things have changed quite a lot in this area, and with industrial farming and other complex issues that I am not going to talk about today. But what's interesting is that water resources were limited, and there is a traditional way of collecting water that was in my family. My grandparents had it in their house, and that's the only water my mother had access to through these aljibes that collect water from the rain. And that's the water the family had access to until the late 60s, early 1970s. And so I think water has an important topic for me, even without realizing as I grew up. And I became really, as I did my residency in preventive medicine, as Dean Long mentioned earlier, I started working on environmental issues where I train at the National Center of Epidemiology. I did a rotation, and this is my first publication looking at different environmental chemicals and the relationship with brain tumors. But when I came to Johns Hopkins University to do my PhD, I had the honor to work with Elisabeth Guayar, an epidemiologist at Johns Hopkins, and Ellen Silbergold, a toxicologist at Johns Hopkins in the Department of Environmental Health Sciences. And that interdisciplinarity was really essential during my training. And I am very thankful for that mentoring team that was very interdisciplinary and that really set me and helped launch my career. And one of the first work that we did together was this studying how environmental metal exposure was related to a form of cardiovascular disease that affects the lower extremities, peripheral arterial disease. And through that experience, I was really trapped by this area of research and acknowledging that something like cardiovascular disease that we tend to think is related to lifestyles is actually very related to environmental factors too. And they start connect this work, this role of the environment with indigenous health. And indigenous communities in the US suffer from an epidemic of cardiovascular disease. They have some of the highest rates of coronary heart disease in the country, an extremely high burden of diabetes, and the acknowledgement that we need to really acknowledge how the impact of European colonization and US policies have contributed to these inequalities. But to me, the most important lessons from working with indigenous communities now for more than 15 years is that sovereignty, cultural resilience, and traditional knowledge are real important core values that have a very important positive influence in what's happening in the tribal communities and how they are able to impact the research that we do. But thinking of these environmental exposures, one of the big problems, environmental challenges and problems we have in the US is the issue of water quality and contamination in water resources. And you can see with red reflecting higher levels of exposure, parts of the country have high contamination in groundwater. Groundwater is used for private wells, but groundwater is also used for community water systems in many areas, particularly for small rural areas and tribal areas. Part of the contamination with arsenic is actually related to uranium mining, as uranium mines and mining in general has been a very important problem, and uranium mining in particular with the development of the nuclear weapons during the 40s, 50s, 60s, 70s, really affected mining in the country and the contamination, and affecting directly tribal communities that are represented in dashed areas in this map. That's actually, there is a connection between uranium mining and contamination of uranium in drinking water. This is an issue that is not very well known, but is receiving important new awareness in recent times. When we look at data like this, it's administratively collected data. Who is behind this data collection, data processes, and who is impacted? These are millions of people living in these communities. But I want to go a little bit more deeper in thinking of who are the people affected. Because each data point means people behind. And that's important: families, communities, the environmental aspects that have a real impact. And so I want to bring here a community in South Dakota. This is a tribal community in the area. You can see each data point is a family. It's a water sample collected from that family. And the colors represent the levels of the contamination with arsenic and uranium in that water samples they are drinking every day. Children, adults, elderly, pregnant women, this is the water that they have access to. And the contamination has been going on for a long time. And what is the impact of these exposures? This is an important question that we've tried to answer over the last 15 years. One way to answer this question is to do epidemiological research, and I am an epidemiologist by training. And one of the advantages that we have in epidemiology for metal exposures, for environmental exposures, in this case metals, is that we can use biomarkers, measures in the biological specimens in the urine or in the blood, in toenails, in other different tissues from the body. And these metal levels in the tissue are going to reflect the exposures from water, air, and food that are integrated in the biomarkers. This is a real advantage because otherwise it could be really hard to identify how people are really exposed to these contaminants. And now we can connect them with clinical disease and other pathways to understand the health effects. We could not do this data collection and this work without teams and efforts that are systematic and locally trained teams who are leading this work. So I want to acknowledge the Strongheart study for allowing this research for many decades now. happening in the Great Northern Plains, North and South Dakota, Southern Plains, Oklahoma, and the Southwest in Arizona. And in these communities, sorry, because this slide is not perfect, too crowded, but you can see in the Strongheart studies as SHS, we have levels of arsenic, tungsten, and uranium that are markedly higher than levels in MESA, who is the multi-ethnic study of atherosclerosis. And these are people living in urban cities, including Baltimore, New York, LA, etc. So people in the Strongheart study in these indigenous communities have higher levels of metals, but the effects have been unknown for a long time. And the study, the cohort, allow us to look over time by doing repeated data collection and very thorough clinical and medical examinations of the participants as they are followed over time. And through that research, we found that, yes, unfortunately, higher exposure to arsenic in the urine is related, and you can see this line that goes up with a higher risk of cardiovascular disease mortality and cardiovascular disease incidence, as well as with earlier subclinical forms of cardiovascular disease, of cardiovascular damage in the heart, as represented with the left ventricular mass index and other measures of the heart, through cardiac imaging, through ultrasound. So all of this data collected clinically through medical ultrasounds, through clinical examinations, become really powerful to understand that some environmental exposures, in this case, exposure to arsenic through the drinking water, are affecting our cardiovascular system. Something important in epidemiology is replication. And we had consistent findings in other studies, which give robustness to these findings, as well as experimental models in animals, where we can see similar effects. An important issue sometimes to evaluate the robustness of these types of findings is what happens when you remove the exposure. Can you see a benefit? And I have an examples here with lead exposure and systolic blood pressure. And you can see in this figure, what we are representing is the decline. The histogram represents the decline in blood lead over time. Lead is a chemical, it's an exposure that, as you know, is very widespread in the environment, but it's something that we've actually done really good public health interventions, and the exposure has declined markedly. And so the decline is positive because most people have reduced their levels over time. And you can see how that's related with the red line with lower levels of blood pressure. And actually the change is quite substantial because on average there is a change of 7 millimeters of mercury, which is quite important. There is a problem with the y-axis. I realize the units are not correct. But this is telling us that, yes, we can improve health outcomes if we remove these toxic exposures from the environment. And a similar finding was found by Maria Telles Plaza, who is also a Johns Hopkins alumna. And she did this work in NHANES, where linking that reductions in blood lead and urinary cadmium were also related to declines in cardiovascular disease. And actually, she found that 22% of the improvements in cardiovascular disease deaths that have happened over time in the US could be explained by reductions in lead and also in cadmium, 8%. So this is really supporting this idea that environmental exposures are toxic to the cardiovascular system, but that we can do something about them if we remove these toxic exposures from the environment. So prevention and removing these toxic exposures should be a priority. And going back to the Strongheart study communities in the Northern Plains, important efforts have been set up to improve drinking water quality in these communities. Unfortunately, there are still many families that remain affected by these toxic exposures. And this is what our Superfund research program is trying to address by bringing system science, innovative technology, and indigenous knowledge. And one of the activities that has done, led by Christine George, who is a faculty, a professor at in the Department of International Health at Johns Hopkins University, and our partners at in the Northern Plains, we put together this participatory trial, clinical trial, to bring filters and treatment systems to the communities in the Northern Plains. This was a big effort. And this is, again, the power of interdisciplinary sciences. I was trained as an epidemiologist, but very quickly, when you move from epidemiology into intervention research, you realize that you need to bring in many more disciplines, including the social sciences, to do this work. And so the framework for this intervention study was really grounded in the social sciences and thinking about all the multi-level factors that need to be accounted for, including at the federal level, at the tribal level, community level, household level, and ultimately at the individual level, so that the intervention could be successful. I am bringing these pictures here of how we started traveling, and this was the pictures, I believe, are from 2013 or maybe 14. When we went, Christine George, as I mentioned earlier, from Johns Hopkins University, and myself, we traveled and we presented this work to the different tribal agencies that were going to be affected by this intervention. The natural resources, environmental, human research. And we discuss, and you can see, I like these pictures because everybody's thinking very carefully at what we are presenting. And actually, we had a very deep debate because there was not necessarily agreement. And the local knowledge and the both technical and traditional knowledge was really important. And so I want to show also the picture at the end because, you know, we had this consensus, and that this was, I have these pictures from the meetings in person, but there was also many meetings over the phone, remotely, traveling, and finally the project took place. And so now I want to switch gears a little bit, and I want to bring another element connected with this technology and innovation in technology. And one of the exciting aspects of this work in the field of metals and metals research is that the technology has really allowed us to do measurements and collect new data points, new points of information that are really powerful and unique, something that we could not have done like 20, 30, 40, 50 years ago. Really, the technology has allowed us to ask questions in a much deeper way. And I don't really want to bore you too much with the different technologies for this particular talk. If it was a more technology-driven or a metals conference, I would go into those details. But I just want to highlight how metals are really important for the world. If you look at the periodic table, the part in red is all the metals and metalloids that are part of our system. And so this is really powerful to understand this. And also, if we think of the human body, the metallome and the metals are really critical. Many of them essential elements in green, and they are organized by their frequency. So the elements that we have at the gram level, at the milligram level, and at the microgram level. And you can see the elements, arsenic, lead that I mentioned, uranium at microgram levels. They are toxic elements that have no essential function in the body. And bringing together analytical chemists who have the knowledge of the instruments, the knowledge of the science, the understanding of these chemical elements, and bringing that together with epidemiology, for instance, the SONAR study, as I mentioned earlier, or the multi-ethnic study of atherosclerosis, as I also mentioned, is incredibly powerful because we can bring our knowledge and understanding of epidemiology with the powerful new technology and data that can be generated to answer really important questions. And this is what we are doing with MESA, as we did with the SOHAR study earlier. And you can see now that a number of essential metals, including especially cadmium, tungsten, uranium, as well as other essential metals such as cobalt, copper, and these metals are now becoming really important because with climate change, we are mining these metals more and more. Cobalt has become a real geopolitical problem in Africa. Copper is also extremely important for the industry. So this has understanding the potential health effect of this element is very important. And if you move from cardiovascular disease to total mortality, you can see kind of similar effects. But when you do epidemiology, you also need to understand the mechanisms and how is this really happening. So bringing in the toxicology and the biological sciences is very important. And epidemiology allows us to answer research through mechanistic markers. And the omics technology here and the multi-molecular technology has become really important. And now I don't have too much time to go into these details, but I really want to bring in the power of omics technology and, for instance, understanding the impact that these environmental exposures have to our DNA. And doing collaborative science across multiple cohorts. And again, the animal studies. And again, I don't have time to go into those details. I just want to show you the power of doing the multidisciplinary science, bringing in the molecular mechanisms. And for instance, something that is in the news quite a lot right now is this concept of epigenetic aging or biological aging acceleration. And we can measure how metals are related to this acceleration of aging. And in this work, you can see how, looking at the panel, bottom panel, you can see how the toxic metals, the non-essential metal, toxic metals are related with accelerated aging, while the essential metals are actually related to decelerated aging, like better aging, less aging. So understanding these combinations of physiological and toxic metals could be important to help with aging processes. So I am now going to bring you the last piece of information as we finish this talk, that sometimes prevention is very difficult and removing exposures from the environment is really hard. So thinking of alternative strategies through improving nutrition or eliminating metals from the body could be relevant. So one of the ways of eliminating some of the metals, such as lead or cadmium, are very difficult to eliminate from the body because they accumulate in our tissues by replacing our essential metals, in the case of lead, such as calcium. But chelation could help. And so metal chelation has become like an interesting concept that maybe it could help with cardiovascular disease. And this is a clinical trial that showed benefit by receiving a chelating agent. You can see here the people who receive a chelation in green had a lower risk of cardiovascular disease compared to those receiving purple. So this is very intriguing and research that we are now conducting. And this study, this new trial is going to be unblinded in the next couple of months. So as finishing the talk, I went a little bit fast at the end with the chelation, and I'm happy to go more slowly over this as we go during the Q&A phase of the talk. But I really wanted to bring back this idea that for a long time, cardiovascular disease prevention has focused on lifestyles and clinical care, improving diet, exercise, management of blood pressure, cholesterol, quitting smoking, management of diabetes. But more and more, the data as I showed here with the metals, but also with data on air pollution and on other environmental exposures, is telling us that the environment is really important for cardiovascular health. And if we want to improve and further reduce the burden of cardiovascular diseases, paying attention to the environment is really critical. In the last month of June, the American Heart Association actually published a scientific statement where recognizing that contaminant metals are cardiovascular risk factors. This is really important because it can really change the discourse and how prevention for and especially adding new tools for cardiovascular disease prevention. So in summary, contaminant metals exposures are widespread, affecting all communities through drinking water, as I really highlighted here today, but also through air and food contamination that I didn't talk so much today. They disproportionately affect rural and indigenous communities near abandoned mines. And we have a substantial amount of evidence showing that they are risk factors for cardiovascular disease. There is a lot of opportunity to advance the field, understanding how these exposures interact with our genetics. These metals are transported into the body, they are metabolized, excreted, they interact with many other proteins and enzymatic processes. So this gene-metal interaction work is likely to become really important in the near future, and it's already becoming very important. When you talk about complex data, such as the data that I showed here today, I like to add this element of caution that the interpretation of the data points is really difficult. And you need to have a real understanding of the biological processes that inform the meaning, give real meaning to the data point. I also want to highlight again how important it is to recognize the importance of the data for the communities who first place generated those data and who must benefit the most by the information that we are obtaining. And the metalonics technology provided real exciting new opportunities for prevention, intervention, and also diagnosis in aspects that I couldn't cover today to improve people's health. I want to acknowledge the participants, obviously, and communities, and also the funding organizations that have made this funding, this research possible, especially the Stronger study, the MESA funding, the TAC2 trial, and other, and the centers, the Superfund research program. And I want to thank and acknowledge the creativity of the numerous trainees that I have been working with over the years, who really have made this research really exciting and important. So thank you to all of them who are doing amazing careers and amazing work. And with this, I think I am done. So I am very happy to answer questions, have a discussion, whatever people would like to talk. Thank you for this opportunity.
Thank you so much for that wonderful talk, especially for showing how important data is in really changing how you understand what you need to be doing to help people. So we do have questions, and so I'm going to help moderate those, and let's get started. So question number one. Can you talk more about how you approached using and sharing the data from this research, given the context you gave at the beginning about the data being on loan and a responsibility?
Thank you so much. This is a phenomenal question. And so the way we do this, the data are currently, for the Stronger study, in a data repository and a data coordinating center, which is located in the University of Oklahoma. The communities, the tribal communities, have agreed to have the data there. And for most of the data, the genetic data is actually at in Texas, at the Texas Biomedical Research Institute. The communities are really aware where the data are. They actually have done something very unique that maybe you'll find interesting. That is that they have done blessing of the biospecimens and the data systems to bring in some respect for us to acknowledge the idea of those blessings is that they make us reflect and think and be aware of the respect that we need to give to those data and biological specimens, which I think is really very good. And so when an investigator needs to access the data, they need to propose a scientific idea. It needs to be reviewed, it needs to be approved, and they need to sign an agreement that they are going to only use the data to answer that question that has been approved. Then once they write the report and have a draft of their paper, before it can be submitted for publication, we need to submit it for tribal approval. And all the tribes acknowledge that they have received the paper, that the paper has been used in ways that are appropriate for them. And they are not really approving the papers. It's more that they are acknowledging that we have work on those data and that they approve that we submit it for publication. We have never had, always all the papers have been approved. However, occasionally questions have been raised. For instance, the study was for cardiovascular disease originally. When we started doing work related to cancer, there was some questioning because they were not in principle aware, they didn't recall that the consent forms had included other health endpoints. So we had to go, and some tribes had actually had that and others didn't. So we needed to go through a process of reconsenting and reapproval for the communities to continue. I also want to acknowledge that one of the communities, so 13 tribes were involved in the study, but one of the tribes declined further participation. This happened in the year 2015. And when that happened, we had to acknowledge that we could no longer use their data. The data, there was a lot of discussion of what we should do at the time. Should we destroy the data? Should we give it back to them and remove it completely from our computers? And with agreement from the tribe who had declined participation, they agreed that we should not destroy the data in case they change their mind in the future. However, we cannot use the data. So all the databases that the students and investigators use had to be clean, and all the data from that community had to be removed. So that's an example of the real challenges that this means when you agree that you respect that the data is not yours.
Thank you. That is very interesting. There's a follow-up question about whether or not you've ever found some of the data too sensitive to share, and whether there's been worry about sharing data openly, whether others may use that data, and how you've coped with that situation.
Yes, so we cannot share the data openly. Anybody who wants to access the data needs to go through the approval processes that are in place. There might be topics that can be very sensitive. For instance, one of them is alcohol use. Alcohol use there is the misconception that alcohol abuse, has happened that publication on data use in tribal communities has damaged tribal communities very greatly, including economically. And for that reason, any topic on alcohol use is going to be reviewed very carefully. This doesn't mean that you cannot publish on it. It just means that you need to be very respectful in how you portray the communities. The other issue is that, I don't know if you have realized, but I never mentioned the names of the tribal communities that are involved. And this is an agreement that we have. I showed you a map from one of the tribal communities in South Dakota. And some of you who know the tribes are probably going to recognize the shapefile and could identify the name of the tribal community. But I am not giving it away easily because the communities prefer that we don't share their names, because it could be also damaging to them, especially environmental contamination and toxicity. The things that we are describing are not easy. There are many challenges when we come to these topics of environmental issues. And so the preference is that we don't share the data, the names.
Thank you. So someone is asking a question about advice you might have for a younger generation of scientists who want to make their research more open, and anything you wish you had known or learned in graduate school that might help.
Wonderful. I have to say that I didn't know almost anything about these issues of data sharing and data respect to data. That's something that it was not part of the discussion for some reason. I think so much has happened since I trained myself as an epidemiologist at the very beginning of the 21st century. And I think it's really good that we are having these discussions today. I think data sharing is something very good and very positive. And I think we all agree that data sharing is a good thing. What tribal communities are worried about is the unrestricted data sharing that could have a negative impact in the communities because of being used for purposes that are not beneficial for them. For instance, with genetics, the communities are very concerned that some of the information could be used in ways that could damage the communities by knowing, or that could be used to benefit like big, large corporations, while the communities that have that genetic information that might be very powerful for development of new technology or drugs could not benefit. And that's the reason why they are not allowing for sharing their genetics or other data through unrestricted platforms. However, they are welcoming, and that creates some challenges with the NIH, because the NIH is requesting for data sharing and unrestricted data sharing. And the communities are not agreeing to that, even when that means not participating in some activities that could benefit them economically. And this is something I also value myself. And if I go thinking of my younger one, is thinking that the short-term benefit of getting a study or economically benefiting from some position or some work might not be worth it, the long-term implications. And the tribal communities are really thinking long-term. It's very rare that they make decisions based on the short-term benefit. And for that reason, for instance, there is the Top Med initiative, some of you might be familiar with it, that allowed to bring new omics data from the NHLBI, the NIH investing a lot of money and bringing a lot of power to the studies. The Stronger study declined, even if that was, people would say, why are you declining? This is free money for free data. But for them, that was not enough because the concerns regarding long-term impact are more important. So this is something I think, let's think about the long-term impact when we make decisions. Oh, I
need to unmute. I'd like to add to that advice that certainly we at the library give people all the time. And I think it's really played out in the way you've been describing this, which is some of the best advice I think you can take is think about it early. Think about it at the beginning of your study. Think about, if I want to share this openly, how would I do that? Who do I need to talk to? How do I structure things in order to be able to do that? So I think you're really showing how much that is a part of how you're doing research, and that you're intentionally understanding from the very beginning what you're planning on doing, and you're talking with the people who are whose data you're collecting in order to have that be a real conversation.
This is wonderful, and I totally agree. And something we are doing with the Superfund Research Center is we are creating a database of databases, or like a web that is going to have a platform that is open, so that people can know which databases are available and which restrictions each of them have, so that you can know the rules for accessing each of them, and who needs to give permission. And so we are really excited about it, because not all data have the same restrictions. And yes, that's exciting for the reason that you mentioned, because it's making us as investigators, as we are generating new pieces of data, to think about that information that needs to be included from the very beginning. And that's really making our things easier for everybody, especially for the junior scientists who want to access the data and can use it.
So I think you've anticipated our next question, which was, this project is the work of multiple institutions. So how do you collaborate with each other to make sure that everyone's on the same page for how you're managing and sharing data?
Wonderful. And yes, very complicated. And some of the data, for instance, all the strong heart study data is, as I mentioned, managed by the University of Oklahoma and Texas Biomedical Research Institute. And then they have a wonderful website where we know all the data available and how to access it. But then we use part of those data for our center, but our center generates other pieces of data that have other ways of being accessed. Some data are from the geosciences, data that are sometimes generated even by the US EPA or the US Geological Survey. And those data are publicly available, but very often we edit it, we curate it, so that it can be reused for different purposes. And so, but because those data are publicly available, it's much easier for us to make it available also in the way we process it. While other data, even for instance, all the animal data we are generating, because this project has also experimental components. So we're also thinking of ways of how to make that available. So yeah, very complex. We have a data management analysis core who is led by Jeff Goldsmith at Columbia University. He's also a Johns Hopkins alumnus from the Department of Biostatistics. You can see Johns Hopkins has a huge impact everywhere. And so he's leading our data management efforts. And you may want to invite him in a future year for your Love Data Week, because he would be amazing, because he's thinking so much about how to make this data accessible, following all the respect that the data deserves and the communities behind.
Thank you so much. So that was our last question. I think we would have time for maybe half of a question left, but if nothing comes in, I'd like to again thank you so much for kicking off the beginning of our Love Data Week. I think you've really helped show how complex data can be, but also how useful and exciting it is in really changing the nature of your research as you really use it and figure out how it becomes, you know, a significant way of understanding a problem in a new and different way. So thank you so much.
Thank you, Dean Long, so much for this invitation, and good luck with this amazing week. It's exciting, and all the best for amazing discussions.
Thank you. And thanks to all of you who have joined us, and we hope to see you at more of our events throughout the rest of the week. Thank you.